Hi, I think it's time for me to provide a little update on my recovery. And I'm going to talk about expectations versus reality, especially regarding the pain and the time for sitting. So, as part of a review, I had APR surgery, colloquially referred to as Barbie butt surgery to remove my rectum about 3.5 weeks ago. And because I had a lot of radiation in that area before the surgery, I required some form of aggressive reconstruction. In earlier videos, I summarized the options for the reconstruction, and I received a gluteal flap, which is exactly what I wanted. The trade off with the gluteal flap is that you can't sit down for a while after the surgery. As I say every time in these videos, this is one patient's perspective on recovery. I'm not a physician. This is not medical advice, but hopefully, if you're going to go through this, maybe my experience is helpful to you. So first, the good news. My pathology results are clean. They took out 20 lymph nodes. They were all clean. The margins were fine. There's probably no need for surgical oncology follow-up for a whole year. They basically were like, we'll see you in a year. The surgeon wants to do the colonoscopy next time, which is interesting, because they were unaware of whether, every GI knows what they're doing. So how's my recovery going? How painful has it been? What kinds of things could you expect to be doing about 3 weeks out from surgery? So let me elaborate on the pain. I said in my first video after my discharge that I was surprised that the pain in my butt was not dominant, but I put together a graph of my subjective experience of pain since my surgery. So right after the surgery, while I was still in the hospital, I had a lot of abdominal pain, gas, cramps. I felt like I was going to explode. But that ended up subsiding pretty quickly. And from a pain perspective, I was pretty good upon release from the hospital. My butt felt a little weird, but not really painful. On the first week home from the hospital, the pain in my sutures got worse almost every day. It would occasionally wake me up at night. The whole perimeter of the flap hurt pretty badly. It did disturb my sleep. I ended up taking one of my 5 Oxycontins during this week. I worried about it getting worse, but I did get a visit from the home nurse, and she looked at it and she thought it looked fine. She thought it was feeling well, so that made me feel quite a bit better. On week 2, the fire dissipated a little bit. Replacing it was a very painful irritation from any sort of motion. The sutures had loose ends that were catching on my underwear, and anytime I walked around, I felt like I had a hairbrush stuck in my butt crack. It felt like the loose ends of the sutures were coming out and irritating the rest of my skin. I did take the second of my 5 Oxycontins that week when the Tylenol wouldn't cut it. At the end of week 2, I went to the plastic surgeon's office. The physician's assistant there told me that the sutures were absorbable. I did ask the residents when I was in the hospital whether these sutures would have to be removed, and I'm pretty sure that they said yes. But that was actually not the case. The specific term for the sutures that I got were called chromic gut, which I think is made from some cow or pig's intestines, and they're coated with something that keeps them from immediately deteriorating. But they were at that point kind of being partially absorbed by my body and deteriorating. And the loose ends were causing a lot of irritation. The physician's assistant got in there and rubbed them with wet gauze, which was pretty painful and somewhat ticklish. And then she encouraged me to put Vaseline or Aquaphor on them, which I had no idea was allowed, just to kind of moisturize them. She also pulled out some scabs, which was painful, but ultimately very relieving. So now I'm in week 3, and the pain is finally subsiding. I'm not even taking Tylenol on a regular basis. I would describe this situation as like having the world's biggest and deepest wedgie. And not the kind of wedgie where your undies rode up a little too much, but a wedgie that you might get from a bunch of neighborhood bullies in the 1970s. Don't ask me how I know that. Feels like a lot of stuffing and irritation. Beyond the wedgie, it feels like my wound is trying to heal, but every time I move my legs in a different way that they're not used to, there's little pins and needles. Maybe the healing's breaking a little bit. I need to move around, but I think that kind of discourages that. Thanks to the aquifer and some lidocaine spray, though, the pain is much better. So I want to correct a prior correction. The plastic surgeon did tell me that the pain would be primarily on my buttocks, and in a prior video, I said that was wrong. In a way, that statement was correct because the highest levels of pain that I experienced were not due to the wound, but they were in the belly pain that I had on the first 2 days. But over the whole course of time, I would say that it is my buttocks that have had the most total pain. And it got worse before it got better. So, and another correction, sitting. I was told I couldn't sit down for 2 weeks after the surgery. If you listen to my past video, I said maybe that's a little bit optimistic. There are other people who say 4 weeks and some people who say 8 weeks. So when I visited the PA and the 3rd week after surgery, she said I could start sitting down again. Yay! Then she gave me the details. So she said for 5 days, I could sit for 5 minutes at a time, 5 times a day, and only on an air waffle cushion. That's not really sitting. That's kind of putting yourself down in a chair and then getting up again. After 5 days of that, I could stretch it out to 10 minutes 5 times a day. And then after 5 more days, I can stretch that out to 15 minutes and so on until I get to about 30 minutes. So basically about 30 days until I get to 30 minutes. What I really want to do is sit down and eat a meal slowly, leisurely. That might be 30 minutes. That's my new definition of sitting. So it might be 7 weeks from surgery before I can sit down for 30 minutes. In an earlier video, I said there were some people who reported that they couldn't sit for 8 weeks. I think it depends on your definition of sitting, but 8 weeks seems to be where I'm headed. It would be hard for me to work if I can't sit down for a half hour at least a few times in a day. When I came home from the PA and tried to sit down for 5 minutes, I did have a rude awakening. It hurt. And it is getting better, but it's still not really pleasant to sit up or get down and up from a chair. I've used a recliner to reduce the blood pressure, and that has made some things better. This week, I'm going to go to my medical oncologist to get my chemo port flushed and hopefully discuss with him the possibility of getting it removed. I figured we'd leave it in case if there was any chance that I needed to get any sort of cleanup chemotherapy. But I think the clean margins and the clean lymph nodes means that I'm probably not needing that. And it should come out. Might hurt. I'm kind of sick of getting cut and poked and anesthetized, but it would be really nice to feel like I'm getting something removed rather than inserted. It's going to be interesting too, because I usually, when I get the port flushed, I have to sit down for a while. And now I'm going to have it probably while I'm standing. On the bright side, I can walk around outside. Every day I'm getting out and trying to expand my range. I think I got about a half mile in today. Finally, I like to end with a few suggestions. I've had an ostomy and wound care nurse. Unfortunately, the hospital has not been very explicit about how to take care of the wound. And if the nurse had known about the observability of the sutures and the use of aquifer, she probably would have been a lot more useful, and I would have got a lot more early relief. I guess if I had to do it over again, I would have asked for very explicit wound care directions for that nurse. Second recommendation is lidocaine spray. I bought some of this Aspercreme lidocaine spray when I was getting radiation. I made the mistake of trying that on broken skin during the radiation. That was a super bad idea because the lidocaine is suspended in some alcohol and it burned like crazy. But finally, I mustered up the courage to try it on my butt flap wound, and it is great. I highly recommend it for short-term topical relief. My last recommendation is kind of silly, but blow dryers. After taking a shower, it's hard to get dry. You don't want to touch those sutures. You don't want to take the chance that your towel catches on a stitch, but a blow dryer is a wonderful experience. You can get totally dry and nice and warm and not worry about any pain involved. That's it for now. Thanks for watching.